spot and go directly in the soft spot, directing to the acromion and inject. The AC joint, palpate the clavicle from medial to lateral until you reach the most tender point. This is the acromioclavicular joint. Put your small needle and redirect it until you go inside the joint. If the injection goes very easily, you are outside the joint. If you have moderate resistance like that, you are inside the joint. Tennis elbow. Palpate the lateral epicondyle and the flesh. The most tender point, mostly this point. So always inject your steroid in this point, not around the bone. This point is more effective in injection and less painful to the patient and gives better results. You can inject simply like this. Or like this patient, you can distribute the injection in all the areas and this one gives better results. As you see, we can do it while the patient is lying down or sitting. If you want to reach the lateral epicondyle, you can reach it from inside. It will be less painful and more effective. The golfer's elbow, we just palpate the most tender point, the common flexor origin, and go with the needle and inject simply. Trigger finger. We palpate the flexor tendon, ask the patient to flex and extend his finger. Inject in the course of the flexor tendon. The goal is to inject in the synovial sheath of the tendon. Make it slowly because it's painful. If it goes very easily, you are in the subcutaneous tissue. If it is blocked, you are in the tendon. If it goes with moderate resistance like that, you are in the synovial sheath. If you have block anytime, you can move your needle slightly forward or backward. Gluteal tendon. We palpate the aggregator trochanter. If you cannot feel it easily, you can rotate the lower limb. Now, this is the point just above the tip of the greater trochanter. This is the gluteal tendon insertion, the most tender point. Just put your needle, we use long needle, you put your needle on the most tender point and inject. The adductor tendon. We palpate the origin of the adductor muscle and inject in the most tender point. Hamstring tendon. We use small needle. This point is the most common point for injection, the most tender point. Just put your needle and distribute it in the area. Biceps tendon. The patient is lying lateral. Palpate the most tender point in the biceps insertion and put your needle. Plantar fasciitis. This is the most painful injection, so take your time. This is the site of the injection, not from down. Inject slowly and take your time. The patient is lying supine. Palpate the tibialis posterior tendon. Go in the most tender points and try to inject in the synovial sheath of the tendon. And you can feel with your thumb the fluid going inside the tendon sheath. Peroneal tendon, the patient is lying lateral. Palpate the peroneal tendon. Check the most tender point. Go with your needle. Aim to inject in the synovial sheath of the tendon. This is the most tender point now. And you can feel with your thumb the fluid going inside the synovial sheath. It's a little bit difficult if the patient is a little bit fatty.